Thanks for being interested in our research. This video will help you navigate through the poster. Let's start from the introduction. After stroke, gait pattern is often affected. People who had a stroke tend to bear less weight on the paretic side during walking. The weight-bearing asymmetry can be easily visualized on the vertical lanes of force vectors. Bearing less weight on the paretic side reflects deficit in lateral weight transfer and vertical limb loading, where insufficient limb loading affects propulsive force and thus decreases walking speed. However, we don't know if it's because they're unable to, unwilling to, or even unaware of being able to load their paretic leg. To explore the answer to this question, we've developed a novel perturbation to deliver impulse limb loading to the paretic leg. Here's a demonstration of the perturbation. The support surface drops 4.3 cm, facilitate lateral weight transfer to the drop side, and force the participant to load the drop limb. Now let's see what's our results. Because initial impact absorption is critical in limb loading, where ankle joint plays a major role in, we reported the measurement in the interval from peak ankle plantarflexion to peak dorsiflexion, which was defined as impact absorption phase in our study. In this representative trial, it seems that the stroke participant had lower power production and angular velocity, and the observation turned significant in our result. The power production is lower in the stroke group, and the total work appears to be less as well. Looking at joint moment and angular velocity, two factors related to power production. Dorsiflexion angular velocity is decreased in stroke group but not joint moment. We dig deeper to see what might be the cause of slower angular velocity. Although not significant, it's likely that decreased angular displacement is affecting velocity. Interestingly, both joint moment and angular displacement have similar contribution to work production in the healthy controls. However, in stroke group, the joint moment contributed more than angular displacement. We then look at ankle joint muscle activation duration to see if there is any abnormality that might affect ankle motion. In our result, the co-activation duration between TA and MG is longer in stroke group. In addition, longer MG activation might be the cause of prolonged co-activation, and the abnormality is also shown in this representative trial. Based on our results, it's likely that abnormal ankle muscle activation, especially in the plantar flexor, is affecting the control of joint motion, which limits the amount and speed of dorsiflexion during impact absorption phase. Eventually, the rate of energy absorption in ankle joint was restricted among post-stroke individuals. Thank you again for being interested in our research. Please feel free to contact us if you have any comments or questions. Hope you're staying safe and enjoying the virtual ASB meeting.